If we don't get enough rest, which is a time for us and our brain to then move things into those areas, then that can impact your memory.
Not using your brain as much because you're not actually socially engaging, you're not talking, you're not doing things, you're not getting those neurons to fire.
You know, we talk about with patients, you need 150 minutes minimum per week of a zoned exercise or endurance types exercises.
Harder time recalling things, remembering things. It could just be as simple as things like, hey, you're not getting proper rest. Hey everybody, welcome back to another episode of Epic at What the Health. And today's topic is going to be
staying sharp after 60.
Oh man, yes, definitely a hot topic for these days because there's a lot of things that we have to offer, whereas before we didn't. So it's a great time to be alive.
Absolutely. So again, as we're moving up into longevity and getting patients to live longer and longer, right? So when we talk about sharp, we talk about all the different aspects of being sharp. So physically sharp, mentally sharp. Let's start with the thing that controls it all, the central processing unit, the brain.
Yeah, for sure. A lot of times in the 25 years plus that we've been practicing medicine, how many times have you had patients come in and they're telling you, Doc, I don't feel like I remember things as much. And I feel like I have a hard time recalling. And they nitpick at little things like, just stuff like I forgot where I put my keys or, so it's, maybe we should start by like trying to give a difference of like, what is true memory loss and cognitive impairment versus just like, hey, you got a lot of stuff going on in life just like everybody else does, and it's okay to forget where you put your keys or where you put your cell phone.
Right. So what's normal versus abnormal in terms of memory? I like to mess with my patients, and I usually tell them, I'm like, what? That happens to you? But you're right. So again, everybody goes through those things where we're like, hey, I forget where my keys are. I forget where I've left my phone or, my glasses, and you're looking at them and it's like it's on your head or you're wearing them, so it's
Right.
What's normal, what's abnormal from memory?
Sure.
What is memory even, and what do we mean by cognition?
Right. So there's strong components, and again, we'll start with where just having a harder time recalling things, remembering things. It could just be as simple as things like, hey, you're not getting proper rest, you're not getting enough nutrition, You're not giving yourself enough time to be able to like mentally, get yourself together. In the fact of we're living in a fast-paced world, and everybody's got 8,000 things going on at one time, and the process of like keeping things in like your short-term memory and then getting them consolidated into long-term memory, there's a lot that goes on there. And the more overload that your brain has, the harder it is for your brain to do that. Whether you're 20 and you're burning the midnight oil and you're running all night and you're only getting 2 hours of sleep, yeah, you're going to wake up in a fog. You're going to wake up where you're having a hard time remembering things. If you're not exercising, you're not eating healthy, all that kind of stuff. So that's just one element of things. But then when you start talking about, true memory issues and true where like now you've got, some things going on, and whether it's genetic and you have a predisposition to developing some issues with memory, or whether it's, you're a vascular patient or you're uncontrolled diabetic, or you're somebody who has some other like, neurologic thing going on that's causing you to have some issues. So maybe we should go into some of that.
So what I'm hearing is, again, just to tell everybody, so memory is based off of several different things, and many different things will create it to be abnormal if we don't do those things correctly. So first and foremost, memory is basically taking things that we've learned or that we've come across, and then you move it. And there's a short-term memory where we remember things like when someone tells you a phone number, this phone number here, and then we chunk them, and then we keep that into a short-term memory. And over time, we move it into a long-term memory. But for us to be able to do that short-term, long-term memory, and what was considered abnormal or normal, again, we know that proper nutrition, if you have chronic medical conditions and they're not treated, it can impact the brain. And as you mentioned, sleep. If we don't get enough rest, which is a time for us and our brain to then move things into those areas, then that can impact your memory. And then what's considered normal, everyone goes through certain things and in terms of like, I forgot where I put things or I can't remember certain names, but when you start to notice where it's impacting you with your family or friends or work, and you're like, wait a minute, I don't remember these certain things where now it's impacting those things. That's when we start saying you need to start thinking about there's probably a mild cognitive decline to the point where you probably need to see somebody and have a conversation with them about my memory starting to fade.
Right. I like to kind of akin to like, even just because, I'm a computer guy. So like, we look into computers, and computers, they have a processing unit, which holds things like, when you talk about like in real-time memory where you're like processing and holding things in the CPU and running things. And then you have like a RAM, which is like the part that holds the brain. That's where like you're actually actively engaging with something. And then you have like your hard drives. And so like, if you want to store something, you can take it from the CPU and the RAM, which is like actively doing and working and engaging. And then if you want to put it and store it so that way you can access it later, is you move it into your hard drive. So our brain kind of works the same way. I mean, again, we model computers around that same thing. So it's like, you're actively doing things, you're actively engaged, you're focusing on something, you're having like a dialogue discussion, and that's kind of working in your CPU, it's the equivalent of your CPU, your RAM. And it's there, it's kind of like functioning. And then it's like, hey, if I want to move this, or I want to turn into long-term memory, all the years that we'd spent training for healthcare, it's like, how many test exams did we study for? Sure. It's, over and over again, doing that repetitive stuff and getting it so we can push it into the hard drives. So when we need it in the future, we can access that hard drive and bring it back into RAM and into our processor. Our brain works the same way. And then sometimes for some people, that hard drive starts to wear down. And some people, the processing unit starts to wear down. And the parts of the brain that are the equivalents, how do we bring that, to attention?
That's probably a different show for us to go over in terms of like, how do we tips and tricks to move things in there and keep them there and solid. We talked about something, and maybe we can shift gears now to a different thing. We started to talk about how certain things affect the brain and memory, including things like proper rest. But one thing we should probably move to next is how exercise and coordination also affects the brain and around staying sharp in your 60s. So what do we want to talk to the group around, how we can potentially think about not just the memory, but the rest of the part of the brain, and how certain things like exercise impacts that?
Number one, first and foremost, the brain is a highly metabolic organ in our body. It's probably one of the highest metabolic organs. When people say like a quarter to even a third of the energy that our body consumes gets used up by our brain for energy, because it's doing, it's firing. It's just kind of like doing all its thing. So then with that, it's like, hey, if you're not getting enough blood flow to the brain, if you're not getting enough, the proper nutrients to the brain, then the brain is like, it's the same thing of, if your car, if the fuel tank, the fuel pipes or whatever they call them.
Fuel lines,
sure. Fuel lines. If they're getting clogged and not getting fuel to the engine is going to start fluttering. It's not going to fire.
Right.
And so we got to make sure we're getting the pipes and the fuel gets to the brain so the brain can function, and it can function well. And how do you do that? Got to make sure that you're the exercising, because exercise is like, it's what's getting the blood flow, it's getting the nutrients, it's getting things through the heart, from the heart and the rest of the body to the brain so that it can function optimized. So it's running on all cylinders all the time.
So again, our brain needs blood flow, and because that's how you get into nutrients there. So we have to move, and as we move and we are exercising, that's causing the heart to pump harder. And of course, the heart is situated in our body close to our brain for a reason, right? It's not close to our legs. So when we were designed, it wasn't designed where your heart is sitting close to your pelvis and close to the legs. It's closest to the area that needs it the most, which is your brain. So in this area here, and we're pumping the blood flow, which the largest arteries are going to be up here, and pumping it to the brain, so that way we can get that blood flow there. So the more we move, the more blood flow goes in there, the more nutrients we feed it. And then, of course, we still need to make sure that we're doing things too, because other parts of the brain, besides the memory component of it, the other component that we were talking about is you need the blood flow and you need the exercise. And maybe we can talk about how much exercise. Like, we talk about with patients, you need 150 minutes minimum per week of a zoned exercise or endurance types exercises. And that's important because that's what's been studied to get enough blood flow to the brain to keep it sharp. But it's also,
you guys heard of the different zone type of exercises?
Yeah, probably something we go over too. But the other thing we need to tell them is, like, when you're exercising, it's important because of other parts of the brain that you're activating, which is your coordination. That's another thing that we see in this age range, is that it's not just memory and, hey, we got to make sure that the blood flow is there and we're getting proper nutrients. But if we don't do the movements and the exercises, so we're not going to get the coordination, which is a different part of the brain that impacts that.
Yeah, so I love that. There's different types of memory as well. So there's like, again, in that part, it's like when we start talking about procedural memory, that's a different type of memory. But that's when we talk about exercising the brain, because the brain is the equivalent of a muscle. And in fact, the CPKs, brain has its own, creatine phosphokinase that we can measure. That being said, when we talk about exercising the brain, it goes back to like even where we're like right now, where like recent studies have been showing that decreased hearing can cause dementia, because when you're hearing less, the potential perception is that you're not using your brain as much because you're not actually socially engaging, you're not talking, you're not doing things, you're not getting those neurons to fire. Therefore, the neurons start to atrophy. If they're not being used, they atrophy, they break down.
You don't use it, you lose it,
Mm-hmm.
is really what it comes down to. You could like us, follow us.
Follow all the stuff, make sure that you hit the like buttons, all those different things that
Ring
people
the
are supposed
bell,
to say.
do the thing you're supposed to do, hit the
Backflips,
subscribe thing,
triple
whatever it
somersault.
is.
Come on in.
Send in the pigeon, carrier pigeon in.
Smoke screens, it's cool.
However else it is that you can. Again, make sure you're following us, and hopefully you'll learn a little something and you'll have some fun.
Yeah, what the hell?
So, and I guess probably now is a good time for us to shift over to another thing that we were kind of talking about in this last section around exercise and coordination, and how important it is for coordination, because the next thing we're going to be talking about is the falls that happen in this age range, and why we need the brain to be sharp, not only because of memory, but if we don't get everything else sharp, then what ends up happening, we see falls at this age range. And that's really where we start to see that, again, because of balance and coordination work, if they don't get those things strong, enough muscle mass and coordination, if that doesn't stay sharp, then what ends up happening, this group here starts having more falls. When you're in the falls, then you get into the hospitals, and nobody wants to be in the hospital. Lots of different reasons, right? Well, some people want to be in hospitals, which is weird, but yeah.
Right. Yeah. So I love it. When we talk about exercising the brain as far as a muscle, it's exercising the parts of the brain that have a lot to do with creating those neurons that help with memory. That's important. Mm-hmm. There's also parts of like exercising the parts of the brain that have a lot to do with like coordination and movement and muscle strength and activity, and the tendons and the muscles and all that stuff, so that we can help keep our mobility and keep our balance and everything, so that way we're not at risk of falling. That's the other part of like, also when we're sleeping at nighttime, we're allowing our brains and the lymphatics in our brain to kind of help remove all the junk and the waste products of our brain. Sure. When we're resting, and removing all of the waste products, because the brain is so metabolically active. And it's also kind of helping consolidate all the discussions and all the things that we've learned through the day to kind of like help get those neurons like aligned. So it's proper nutrients, it's exercise to get the blood flow to the brain, it's exercise to make sure the parts of the brain are the coordination and balance and movements working. It's making sure that we're exercising the parts of our memory by doing all the things. But what about testing? Like, what can we do to start like doing things to evaluate people at the office?
Right. So I like to test patients, have them get up and do the get up and go test. Right. That's one way to check coordination. It's basically how long it takes you to get up and actually start moving. If you get up and it takes you longer than 10 seconds to get up and go, that's an issue. There's other things that we can test as well, and that helps us to understand different parts of the brain and where there may be potentially some weaknesses, that including grip strength. People don't understand that grip strength tells us not only how strong and active their muscles are and their muscle spindles, but it also tells us in that part of the brain if coordination is down and not. If we start to see that grip strength is starting to fall, simple tests like that and testing these kinds of things can give us a lot of information around whether there is a high risk for potential for falls. And that tells us if there's what they call sarcopenia, muscle mass is starting to drop, coordination starting to go down. These are things that we can do in the office and test these kinds of things. There's also questionnaires that we test, the fall risk questionnaires. And these questionnaires are easy questionnaires that are standardized, and then we will see whether or not they end up falling. And if they don't pass these questionnaires or these screens, we'll send them over to our physical therapy and our exercise physiologist, and they will then go and do more testing with them to see whether or not they are truly at a high risk for falls. And if they are, then we can put them into a program and say, because again, a lot of these things, as we know, the brain is what they call plastic. It can recover, but it requires a lot of work, because now we're talking about you're going to have to increase your muscle mass, you're going to have to increase your coordination, your balance. One of the simple things that I do with my patients is I'll ask them, if you were to able to stand tandem, foot in front of one foot, and do certain things and do some twisting maneuvers, are you off balance or are you going to fall? And that's important because, again, we don't want them to go onto like high steps or ladders when their coordination is off. They can fall and then they can really hurt themselves if they're at height. So those are things that you got to be careful about. And there are certain things that you can just test at home, or when you come in, we can do those things. And we get a lot of weird looks sometimes, like when we start testing patients and they're like, why are you testing my grip strength? And we're like, well, we need to know this for this, that, and the other. And, our patients know we mess with them. Mm-hmm. So
a lot of times they're like, I just mess with you, or you actually.
Right. So then they're like, wait a minute, this is a real thing? And we're like, yeah, no, this one actually is. The one that I did before wasn't, but this one is. So
right. Yeah. And then the other part is like, so there are actually true like objective tools that we have now. Thankfully with modern technology, we have the means now in our centers where we can actually do some fancy testing that we can actually check for like the 8 or 10 different levels of cognitive domains, whether we're talking about like higher cortical functioning, executive functioning, all those different things.
So maybe we talk about that next. So, again, we just talked about fall prevention and balance work and how we test there. Maybe we can move into the next segment, which is around how we at our offices test their cognitive domain. And what does that mean? Mm-hmm. And then what are all the different components of the cognitive domain? And then within it, how we can test those things longitudinally, meaning over time, test it and then see whether or not the things that we've asked patients to do, are they doing them and are they effective, and how we potentially can modify it and get them there faster.
Sure. And definitely checking for what we call MCI, mild cognitive impairment, is one thing. So there's, you're just normal. You just, hey, you're overwhelmed. You got a lot of stuff going on in life, and you're just, you're struggling with remembering small tasks or things like that, just like everybody does. And it's like, hey, need to work on just go back to the basics. It's exercise. It's getting the proper rest. It's making sure the nutrients. It's, making sure the blood flow to the brain. But then if there really are things going on, when we start testing, with the objective tools that we have, we can start measuring, like, are you really having some mild cognitive impairment? Are you going from mild cognitive impairment to maybe mild dementia or moderate or severe dementia? And then what can we do to intervene?
Sure.
All the way through that whole spectrum? And that's we could have like a whole week's worth of series of, discussions on that. But
for sure.
But there are also, thankfully, there are a lot of tools now that we have that we can actually use for the individuals that are going down the MCI pathway or the dementia pathway. For family members, for individuals who are going and struggling through that, there are all kinds of things that we can do. So
I think it's important to also just kind of go over that there's when we talk about testing and diagnostic tests in general, we're talking about what we call a screening test and and then versus a diagnostic test. So if a patient or a family member comes in and says, hey, I'm having these symptoms, that's a diagnostic test. You have something and we're going to try to diagnose it and we see where you're at. As opposed to, I'm coming in for my wellness exam and I'm in my mid-50s. And hey, I'm here and part of my wellness exam is a screening test. And a screening test doesn't mean that you necessarily have symptoms. We just want to get baselines and we want to screen to see whether or not you may have something that you're not even aware that you are in a certain level. But now we have some data points where we can then track it over time. So if somebody comes in here and we do one of our cognitive function testing and we score it, and in ours, anything over 75 is considered normal and all the way up to 100. But if they come in and I'm in my 50s and I'm at 77, well, you may be in the normal range, but that's pretty low for you. And then we want to track that over time and see where you're at. But that's the importance of these tests, is because then we can break it down into, well, which domain, as you were mentioning, is off, and then, hey, you need to do more of this. You need to do these kinds of memory tests, or these kinds of
spatial, processing thing, or is it an executive processing thing, or there's a bunch of different domains. And again, we can get real technical on that side, but again, that's the part of we want to try to. Then we really want to do a deep dive and try to figure out, okay, what element of things are going on, and what do we need to is the individual going down a certain pathway, because there are several different types of dementia, several different types of causes. A lot of people don't recognize that because of the fact of just uncontrolled diabetes or uncontrolled blood pressure or things like that. In fact, because of the volume of individuals in this country that have so much, uncontrolled high blood pressure and diabetes and all those kind of things, those individuals are oftentimes at higher risk of having some cognitive issues because of the uncontrolled diabetes and because of things like vascular, like we talked about, getting the fuel lines to open up. Like we can do tests to make sure that the fuel lines are okay to the brain.
I love it. So maybe we can go into this last segment here and talk about, when is it important for you to speak to your doctor or your provider about these kinds of things? If you have certain medical conditions, or as you mentioned, who is at higher risk, how can we potentially tell individuals that these are the things that you should be looking for, especially if you have these things? And then how do you then present and then discuss it with your provider?
Yeah, boy. I mean, again, we could go through a whole segment of like, what's the proper,
Sure.
but I feel like we've hit a lot of the basic things on age related and or for individuals who are in their 60s above, and we start talking about memory, because again, it could be problematic. Our own father, suffered with dementia,
Sure.
and we saw him, his body was still in good shape, but his brain, it was tough to see our father being that way. So it's certainly something that impacts a lot of people, can have impactful changes on households.
Right. So again, back to if, like you mentioned, if you're a diabetic, if you have blood pressure that has not been controlled, if you are someone who has a family history of it, if you have, any of those risk factors for things like if you're doing sedentary jobs or where you're not moving a lot, because again, movement is so important. Those are things that put you at higher risk for problems with memory and impairments. And now we also know that there's genetic markers for some of these things. And there's even genetic markers that we can test to see whether or not the brain is getting better, like the BDNFs and things like this. So those would be some of the things that can put you at higher alert. And then as we talked about, if you're starting to do things and you're starting to notice, boy, my coordination is off, I'm tripping more than usual, or I'm having trouble from, again, just being able to do things, and even your own little random tests of, can you do tandem walking? And if, boy, it's hard for me to do that, bend down, tie my shoes without, again, starting to drop to one side or another. These are all little cues that probably need to go and talk to your provider. The other one is if you or a family member is been forgetting more, it's starting to impact things like not just you're forgetting, hey, where did I leave my keys? But hey, what are keys used for? Now you're starting to go, oh boy, I don't know, not just where things are, but also what they're used for or who they are. Then we know that we probably need to come in and start talking to your provider about these things.
Right. And oftentimes, like your point, it's usually a family member or a loved one who's the one who's really going to start recognizing that, because most people themselves don't have the self-awareness when they start getting to that point of that they're
So true.
They usually are actually more in a denial phase when that's right.
So true. Because again, especially if it happens gradually to the point where you just kind of, oh, I'm just used to it now. Right. Because most of these things don't happen suddenly, they happen over time. And because they happen over time, then we just get used to it. But somebody else points it out like, hey, did you notice that you're doing this more? And that's when you start like, you know what, I probably need to speak to my provider about it.
Right.
Great episode. I think we covered a lot of things in terms of what to think about in terms of staying sharp in your 60s, and the things what we, again, want to bring up in terms of like what you need to start looking for, either from yourself or somebody else. And then if you're somebody who is a caregiver for someone in their 60s and beyond, look for these things, and then, talk to your provider.
Sure. And just to wrap up, a couple of, again, going in addition. So if it's your uncontrolled diabetes, high blood pressure, vascular history, strong family history, maybe noticing a loved one notices somebody who has a lot of these things, decreased hearing, shuffled gaits, getting more imbalanced,
If you're
falls
on 5 or more medications,
right? All these kind of things would be contributing to stuff where individuals have some cognitive. But another episode of What the Health with the Naaman Bros.
Appreciate everybody joining us for this session. Hopefully you guys learned something. Yeah. And if you know somebody who could benefit from these things, again, call us, email us.
Remember what we were just talking about, but
right. So I'm going to put up an appointment for Ted so he can get seen. We're going to get him in, and hopefully he'll remember what we talked about. Right, and we'll get them in. All right, guys. What the health?
What the health?